Deliberate self-harm, abbreviated as DSH, and it is basically defined as an intentional injuries which are caused by the person himself or herself to their body, is again a very serious condition, and usually they present as one of the major psychiatric emergencies in the ER department. So one should know how to deal with such emergencies, and basically they can prove to be fatal in a lot of conditions. Sometimes they're not fatal, but still, when they're not fatal, they are basically regarded as the self-mutilation kind. So self-mutilation kind basically can range from just a tattooing phenomena. It can be basically an adverse tattooing phenomena. Normal tattoos do not basically lie in the category of self-mutilation. But if it's an adverse tattooing phenomena, then basically it lies in the self-mutilation forms. And then there are other forms which are also categorized in the self-mutilation category. So over here, we'll be discussing this self-mutilation. How do a lot of people find pleasure or find peace when they're causing injuries or harm to their own body? So it's again very important how to define this condition, and then we'll go on to describing the causes which can result in the self-mutilation phenomena. Obviously, the risk factors and the causes they basically revolve around the environmental condition of that particular person about whom we are talking about, or we are basically categorizing him in the self-mutilation category. Then there are a lot of personality traits that can go about this self-harm or the self-mutilation phenomena. So all of these risk factors and all of these causes will be discussed over here. And along with that, the differential diagnosis of self-mutilation will be discussed. So there are a lot of organic disorders which can also present in the same manner, and they can be confused along with the self-mutilation. So we'll be discussing them over here in this very first section. The psychiatric emergencies that are usually seen in the ERs, there's a long list to it, and the major category is the deliberate self-harm that we're talking about today. The physical emergencies basically range from deliberate self-harm, which can prove to be fatal, as well as it can prove to be a non-fatal self-mutilation kind. Then we have the behavioral problems. There can be the acute behavioral problems resulting organically or resulting due to the effects of some sort of a pharmacotherapy that the patient is taking. For example, lithium toxicity is seen in a lot of patients. And then we have the unwanted effects of the psychotropic medications. So the antipsychotic drugs can again result in the acute dystonias or in the acute behavioral problems. So dystonias, this is one of the psychiatric emergencies which is quite commonly seen. And then we have another disorder which is known as the neuroleptic malignant syndrome, abbreviated as NMS. So it's one of the conditions that we see quite often in the emergency departments. Then we have the lithium toxicity. Obviously, it results from the lithium intake, although it's given for the mood disorders or the bipolar affective disorders, but it has its toxic effects. And basically, the toxic effects basically appear at a very low dose. So it's very important to monitor this drug. Then we have the acute delirium that is quite commonly seen in psychiatric emergency departments. And then we have the withdrawal from the alcohol or benzodiazepines. So it can be one of the alcohol or the benzodiazepines withdrawal symptoms that are seen in the patients, and they even present in the psychiatric emergency departments, and you should know how to deal with such patients as well. So over here, we're talking about the deliberate self-harm. Defining deliberate self-harm, it's basically the self-harm or injury irrespective of the apparent purpose of act. So basically, you injure yourself, the person, the patient who is suffering from this kind of a condition, a mental condition, a psychiatric emergency. It can be created into, if it is a fatal kind of injury, the patient can land up in an emergency department after this kind of a self-harm or injury. The factors that are responsible for deliberate self-harm, they include the personal factors, and then we move on to the psychological factors. The personal factors would include all the personality traits of that person. If he's a borderline personality, if he is suffering from any sort of an obsessive compulsive disorder, all of these would basically correlate with this kind of a deliberate self-harm behavior that is seen in a lot of individuals. Then we have the psychological factors that are seen in a lot of patients. Then we have the health issues. If a person is suffering from any terminal illness, then again, he's more prone to this kind of a behavior. Health and illnesses along with that. And then we have the cultural factors or the socio-economic background that plays its very pivotal role in contributing towards this kind of a deliberate self-harm behavior or a self-mutilating behavior. So over here, we have the parasuicidal or the attempted suicides. Again, a lot of suicides do not end up in the fatalities, and sometimes they are not. Basically, these kind of behaviors are known as the parasuicidal behaviors or the attempted suicides. The precipitating factors over here are that people who are already inculcated in a behavior of the deliberate self-harm, or they had a history of deliberate self-harm, they would be more prone to this parasuicidal behavior. So again, the interviewing is very important over here. A complete detailed interview would reveal the thought form and the thought content of that person. Basically the suicidal intentions and what are the plans for that suicide. That will give you an idea whether he or she is planning for a suicidal attempt or not. Then we have the experienced stressful problems in the past 6 months. So again, if you get a history while you're interviewing and you get a history of stressful events in the past 6 months, you should basically dig upon that criteria of the parasuicidal or the suicidal attempted behavior over here. Before the act, there should be a proper planning that he has or she has in his mind. You'd basically sort out the plans, the thought content of that particular person whom we are talking about. So the predisposing factors would basically include the familial developmental problems. It can be a genetic problem. There are a lot of researches going on regarding this self-mutilating behavior, and they have revealed that there is a genetic correlation to this kind of a behavior. Then the early parental loss through the bereavement. So again, there are these stressful events in their life. If there are relationship difficulties or there is a parental loss, then again, it's basically regarded as to be surrounding this deliberate self-harm behavior. The history of neglect or abuse is frequent in people with self-harm, the personality disorders or socioeconomic status, and then again, the long-term problems with the partner or the ill health. So you have to basically conclude whether he's suffering from any kind of a terminal illness or not. In UK, personality disorder is identified in almost 50% of the DSH patients over here. So differentiating the suicide attempts from these SIBs is again very important. This assessment criteria is again very important. What are the expressed and unexpressed events in that life? The suicidal attempt criteria to escape the pain and terminate the consciousness. And then we have the relief from the unpleasant effect, that is the anger, tension, and sadness in the SIBs. Then what was the level of the physical damage and potential lethality? In the suicidal attempts, we have the serious physical damage, lethal means of self-harm. In the SIBs, we have the little physical damage and non-lethal means are used. So while we are considering the self-mutilating form, there are the lesser fatal injuries over here. Is there a chronic repetitive pattern and potential lethality? It's again one very important question to be asked. Rarely chronic repetition and some overdose is repeatedly seen in the history of the suicidal attempts. While talking about the self-mutilating behavior, there are the frequent chronic high-rate patterns seen in the self-mutilating behavior. In the suicides, basically, it is defined as a death caused by the self-directed injuries behavior with an intent to die due to the behavior. The committed suicides are equivalent to crime or sin, and the completed suicides are termed to be deemed. There are preferred terms, for example, death by suicide or died by suicide. So these are the terminologies that are usually commonly used. A suicidal attempt is a non-fatal self-directed potentially injurious behavior with an intent to die as a result of the behavior. It may or may not result in the injury, or it basically doesn't end up or prove to be fatal for that person. So in this section, basically, we highlighted the criteria for the self-mutilating behavior, what are the risk factors, and what is the situation behind all of these deliberate self-harm behaviors. So that is the end of this section. Thank you for watching sqadia.com.